If you're experiencing an acute onset of low back pain, I'm going to show you 4 tips you can do at home to try to reduce your symptoms and get back to moving. So the first movement that I'm going to do is going to be a standing lumbar traction. So what you're going to need to do is go up next to a countertop or a back of a couch or a chair, something stable. I'm leaning forwards, and as I'm leaning forwards, I'm pushing down with my arms. So I'm pushing down my arms. Now here's the trick. A lot of people come up on their tiptoes when they do that, and that's the wrong thing to do. You want to keep your feet flat on the floor. So I'm going to focus on keeping my feet flat on the floor. I'm leaning forwards and I'm pushing down like I'm trying to pick myself up using my arms. Now, if you have shoulder problems or arm or hand problems and you can't do that movement that way, you can take a pillow or a cushion, put that over the back of a chair or your couch, and lean over just like this, and just lean over that and kind of let your torso kind of pick your body up to create that little bit of traction in the lumbar spine to take some pressure off of those discs and the nerve roots. The next movement we're going to do is going to be a seated kneaded chest stretch. Now, if you can lie on your back and do this, that's great too. But for a lot of people, when you're having that exacerbation of low back pain that's just come on acutely, recently, it's very painful and you may not be able to get flat on your back. So you're just going to do it in this position. So I'm just sitting. What I'm going to do is focus on bringing my knee up towards my chest. So just bringing up, and I'm going to hold that somewhere between 10 to 30 seconds. Now, if that's too uncomfortable, even me just trying to pull that makes it uncomfortable, I can sit in a chair and prop my feet up on a stool and just alleviate some of the symptoms of the stress that I'm having on my back just by propping my feet up on a stool and then lean forwards at the same time. We're basically just trying to open up that lumbar spine a little bit if we can, just to create a little bit of relief on the nerve roots and on the disc. Next, we're going to do standing trunk extensions. So just repeated trunk extensions. I'm just going to put my hands on my hips just like this. I've got my feet, shoulder width apart, whatever feels comfortable and stable. And then I'm just going to lean back and look up when I go back, focus on trying to go back as straight as I can, just leaning back and going up. And I would go as far as I can, as far as my pain allows me. And I would just repeat that 10 to 15 repetitions for a couple of sets. But that's something you want to do throughout the day. So high frequency of that movement throughout the day. Just hands on the hips, leaning back as far as you can, and then coming right back up. It's normal for initially to cause some increase in discomfort in the low back. Theoretically, the more that you do it, the better it should get. Or if you have radiating symptoms down the leg, the more that you do that position, the less that you should feel that. If it gets worse, you definitely want to stop doing that movement and make sure and go back to your doctor. The last movement is going to be a prone partial cobra and then progressing into a full cobra position. So I'm just on my stomach here, got them propped on my elbows. I'm going to start kind of bringing my head down and then going up. And as I go to the top, I'm going to kind of feel that little bit of a pinch in my low back, maybe right here. Just going to go as far as I can. I'll hold that between 5 to maybe 10 or 15 seconds and then go back down. And I repeat that for 1 to 2 sets of maybe 10 to 15 repetitions as my pain allows. Then as I feel like my pain is improving, or maybe my symptoms down my legs are improving, then I'm going to start working on going into a full cobra position, all the way up, looking up at the end, hold that position, and then roll back down. And then I'm going to go back up again, and then I'm going to hold that. And I'm going to hold that position somewhere between 10 to 15 seconds if I can. You may feel some discomfort in the low back. If it increases your symptoms down your leg and your foot, that sciatic nerve pathway, then you're going to want to back off of that. Don't go as far. And then as you can tolerate it, it gets a little better, then you can go farther throughout the movement.